Hi, my name is Brianna and I'm a student nurse. I'll be following you today.
Oh, hi, Bree. How are you?
Good. Can I have the SBAR report on your patient?
Yes, her name is Shanananana O'Connor. She's a female, 34 years old. She's in room 231. She's full code, has a renal disease diet, 1,500 milliliter fluid restriction, and her physician is Dr. Engelbert. She does have an allergy to trimethoprim sulfamethasone, and she gets a rash from that allergic reaction. She came in with fevers, chills, general malaise. She's a type 1 diabetic since she was 8 years old. She has end-stage renal disease for 1 year. She is listed for a kidney transplant 6 months ago. Her blood glucose levels have been elevated, which is consistent with a possible infection. Usual dose of insulin is not controlling her blood sugar well. She has a decreased appetite, reduced urine output, and she says that it's dark and more concentrated. She's had a weight gain of 10 pounds. She's currently at 177 pounds. She had a graft infection 3 months ago, which resolved after IV antibiotics, and she does have recurrent UTIs, has a history of UTIs. Her vital signs, her heart rate is 108, respiratory rate 20, O2 stats 97%, blood pressure 138 over 78, temperature of 100.9 Fahrenheit, which is a little bit high. Her pain 2 hours ago was a 4. She is alert and oriented times 4. Her current meds are calcium carbonate, renal multivitamin, aspirin, clonidine, insulin, erythropoietin, atorvastatin, and we're about to give her antibiotic therapy now. From her physical exam, my assessment, her skin was warm, intact with mild diaphoresis. Her IV is in her right median vein, which is how we're going to give her the antibiotics. She denies pain when she's urinating or any difficulty. It's just the amount is decreased and the urine is dark and concentrated. She does have numbness and tingling in her lower legs, which is consistent with diabetic neuropathy. Her AV graft appears clean, pink, intact with bruit and thrill present. She has tachycardia with regular rhythm. She has slight +1 pitting in lower extremities. Her lab results, her blood glucose is a 210 milligram per deciliter at 5:45, so almost 2 hours ago, which is elevated. She says that she's lost most of her friends from having to receive the dialysis 3 times a week, but she does still have one close friend, so we're going to want to analyze her psychosocial behavior. I recommend the patient continue dialysis today to prevent toxicity. We're going to assess the IV site when we go in there, check for swelling, redness, or signs of infiltration. We are going to administer IV antibiotic therapy, normal saline as the primary infusion, and then a piggyback is going to be the antibiotic imipenicilin. We are going to educate the client about the new medication and possible side effects, which include C. diff and superinfection. We're going to continue to monitor the blood glucose levels. I recommend that we call the physician to see if we can adjust the sliding scale maybe to a higher sliding scale, since her normal blood glucose, her normal insulin isn't working, possibly because of the infection. And we're going to monitor her BUN and creatinine levels.
Okay, awesome. Thank you. So why is the client receiving the antibiotics?
Well, Dr. Engelbert suspects an infection, so we ordered the IV antibiotic therapy to rule out bacteremia or UTI because the patient has a high temperature, she has chills, she reports decrease in frequency and volume in the urine is darker in color, but she does deny pain, difficulty when she's urinating. The elevated blood sugar and decreased appetite are also indications of possible infection. The antibiotic...
So what action does the medication have on the body?
Okay, so imipen is going to inhibit bacterial cell wall synthesis. Psilocybin prevents metabolism of the imipenem, resulting in increased urinary recovery and decreased renal toxicity.
Awesome, thank you. So when should you question administering the medication?
We would question this because it's contraindicated with hypersensitivity, cross-sensitivity may occur with penicillins or cephalosporins. We're going to use it cautiously if they have a previous history of multiple hypersensitivity reactions, any seizure disorders, renal impairment, but this client is receiving hemodialysis within the next 48 hours, so that kind of allows us to administer it.
So does the medication have a therapeutic serum level?
No, the peak is at the end of the IV infusion with a drug duration of 6 to 8 hours.
And which vital signs should be monitored?
We're going to monitor all vital signs because this client has end-stage renal disease, so her creatinine and bun should also be monitored while on this medication.
Okay, that's all the questions I have for now.
Are you sure?
Oh, actually, I have a few more. I'm sorry. So which physiological parameters should be monitored when the medication is being administered?
Because the medication is used with caution in clients with renal disease, we need to ensure her hemodialysis does occur within the 48 hours within getting the medicine. And we want to observe for signs and symptoms of anaphylaxis, so rash, wheezing.
Okay, so what interventions must be taught to the client to ensure the medication is administered safely in the hospital or at home?
So this is going to be administered in the hospital while she's here. So we're going to advise the patient to report any signs of superinfection, which are like a black furry tongue almost, and also any allergy to the medication, C. diff, which would be like foul stool, diarrhea. She's gonna obviously want to treat that with antidiarrheals, but she should seek a physician before taking any medicines that stop diarrhea. We're going to caution the patient to notify the healthcare provider if fever or diarrhea occur, especially if the stool contains pus, blood, anything that is not supposed to be there. And we're going to observe the patient for signs and symptoms of anaphylaxis.
Okay, so what are the side effects and potential adverse reactions?
So seizures, drop in blood pressure, C. diff, rash, phlebitis at the IV site, or allergic reaction, including anaphylaxis.
Okay, so how will you know the medication is effective?
We will know the medication is effective if the signs of infection are resolved, and the length of time for complete resolution depends on the organism and the site of infection.
Okay, that's all my questions.
Okay, well, let's get in there.
All right.
Knock, knock, knock.
Hello.
Hello, how are you?
Good, how are you?
Good. I am Nurse Shelby. This is my student nurse Breezy. She's following me today. We are going to administer your antibiotics today. So they are about due. It's within an hour of when they're due, which is good to go. I just want to monitor the IV site, and we're going to flush, make sure that IV is patent.
Okay.
Can I get your name and date of birth as we begin?
Shanananana O'Connor, and I'm 34.
Okay. O'Connor, 34. Good. And do you have any allergies?
Yes, trimethoprim naloxone.
Okay. And you have that bracelet on?
Yes.
Great. Okay. So we're just going to make sure that this is patent, so when we are giving her the medicine that she actually gets it and it's not stopped.
Let me disassemble this thing for blood.
Okay, good. Do you have any pain?
No, not right now.
Okay, good. There's no redness at the site. That went in really well. No resistance, no pressure. Okay, so just know that anytime you're staying at the hospital, you have the right to refuse any medication. So this antibiotic is hopefully going to help with your fever and any suspected signs of infection. So would you like to have this medication?
Yes.
Okay, great. We'll go over some of the side effects and whatnot. Okay, one more time. Can I get your name and date of birth?
Shanananana O'Connor, I'm 34.
Good. Okay. And so we are giving you sodium chloride and also imipetin.
Oh, the question?
Cytostatin. Just want to double check that. Okay, the time is good. We're within an hour.
But yeah, as soon as we're done.
Dose 30 milliliters per hour, and the bag is 500 milliliters. Good. And when you have these bags, you just want to double check that there are no holes, no leaks. It's not cloudy. Both bags are good. Okay, double check that. Again, just just want to check your name, the medication. And we put,
So how many times do you have to check the 5 rights?
well, definitely the medication you want to double check, and the patient ID is 3 times, and then the route and dose and time obviously is going to kind of come in that when you're going back and forth. But
Okay.
3 times the charm, I guess, for all 5. So patient,
Okay.
dose, route, time, and did I say dose? Date. Wait. Patient, route, time, dose, drug. Yes, obviously the drug. Okay, so check that. Let me scan this. Okay, can I get your name and date of birth again?
Shanananana O'Connor, I'm 34 years old.
Okay, and you would receive sodium chloride, good. I'm gonna spike these, they're both sterile ends. So as long as you don't touch the ends, you're good. You don't have to wear sterile gloves. Gonna hook this up. And since we're doing IV piggyback, you want to make sure that the primary solution hangs lower, otherwise the lower drug is not gonna get in there. What else? Okay. Stay up here. I'm just going to document the site, so it's her right median vein, the IV site is. Okay, the time, it is 7:35. Okay, and all the nurses that I've learned from, they like to run this first, and then get the IV set up. So we're going to...
I think I've seen that before. Is that called priming the tube?
Yeah, so we're gonna make sure that there's no air bubbles in here. We kind of fill it like good. We want to fill this chamber halfway. You just want to make sure, good, this stayed off the ground. I just want to make sure that this doesn't touch the ground and that the chamber is open when you're priming it.
Okay.
So I'll take the sterile tube off, the cap, open up the line. And since we have a lot of fluid, you can let a little bit more go than when you would with the antibiotic. Okay, good. So shut it off. So none of this is going to go until I actually set up the pump.
It looks like we have some antibiotics that we will use today.
Fill the chamber halfway.
Showing here you're scheduled for gentamicin. Looks like we're hanging that on an IV.
Okay, new patient, yes.
Do you have any questions about that? No? Great. So it's going to take me a few minutes to get off that.
Channel select, so it knows that it's this guy, basic infusion. Okay, we want to double check the rate, so it's 30 milliliters per hour. We'll just double check it again, 30 milliliters per hour, sodium chloride, good. Okay, and then the milliliters of the bag is 500. Okay, and then we're just gonna check for no air bubbles, which there are not. And then we're going to open up the clamp. Press start. You just have to know how to breathe.
So how many drips do you look for in the chamber?
We're going to look for 5 drips, and the green means go, so we can start kind of counting. And if at all you hear this beeping like crazy, it could be that the line's occluded, your arm's bent, so don't freak out. We'll come and fix it. The SBC student nurses are great at that. 2.
I think I saw 5.
Yes. Okay, good. All right. So now we're going to do the same thing, but with the IV bag, and I'm just going to, or the IV bag, the antibiotic. Okay. So again, just can I have your name and date of birth?
Shanananana O'Connor, 34 years old.
Good. And you have an allergy. Okay, and again, the time is good, the drug is right, the route, IV, the time within an hour, awesome. Okay, again, green means go. Missed the time. Okay, so again, we're going to want to prime the line. I spiked it before. These 2 ends are sterile, so as long as you don't touch any of them, you're good. And because there's not as much fluid in this, we aren't going to kind of let it go as freely as we did with the saline. Okay, and then also just you want to label the tubing, which I did before, so they know when to change it. So you're going to date it, and then usually the hospitals have like what date they should change. So I think at Baker it's 4 days, so they have different colored labels, and we've labeled the drugs as well. So we're just going to make sure there's no bubbles. I guess I should do that first. Okay. And again, the piggyback we want to hang higher, so gravity will kind of let it do the work and actually go. There's a lot of different ports that you could possibly put it in. We want to put it in the one that's closest to the pump and before the pump, so the drugs actually get there at the right time. This had a cap on it, but we'll just clean it just to be safe. Okay, and then channel select. We're going to go to secondary. It's an I, imipenem statin. It already has the drug rate in there. And we're going to administer it over 30 minutes. And I'm just going to double check that. Good, the time, the rate. Yeah, good. Also with, you have your 5 rates, and then with IV bags you usually want to include volume as well. So that might be the 6th one. Okay. Verify secondary clamp open, which we will do. And press start. Okay, and then again, we're going to look for our 5 drips. 1, 2, 3, 4, 5. Awesome. Okay. Okay, TJ, don't give meds. Okay, I think I just left them on the arm. One second. Okay, awesome. Okay, so we are giving, the medication we're giving you is imipenem cilastatin. Okay, so here's some information on this antibiotic. Okay, the model is beautiful, so just take a look at that. 2 of the side effects of the imipenem cilastatin are going to be your C. difficile. Okay, so as the picture implies, you'll have diarrhea, you'll have foul-smelling stool. Okay, and then another one is another side effect is going to be superinfection. Again, another handsome model. So with this, you'll find kind of like like a black furry substance on your tongue. You'll also have diarrhea, foul smelling, stool. So if you come across any of those or experience any of those or think that you're experiencing any of those, you're just going to want to let us know. So pop quiz, what are 2 side effects from the medication that you're giving?
Well, I think it's C. diff and superinfection, and I should probably tell you about that, right?
Perfect, yes. Okay, so you're going to want to just read through those, and maybe there's something written small in there that you don't think is a big deal, but it could be. So just let us know any of that.
Okay.
Are you comfortable? Is everything good?
Yes, I'm fine.
Okay. So it says air in line, which sometimes happens.
So does that just mean there's air in there you have to get out?
Yes.
Okay.
And these things are very sensitive. So yep.
Oh, I see. You just have to get the air bubbles out.
Yeah. And then so open, get the bubbles out, and then restart.
Awesome.
Okay. Do you have any questions, any comments, concerns?
No, I'm fine. Thank you.
Okay, is there anything else I can get for you?
Nope, I'm comfortable.
Okay, so your call light is right here. I'm gonna lower you to safe position. Okay, I'm gonna set your bed alarm. Okay, all your belongings are right here. Everything's good to go.
Well, thank you, Nurse Shelby.
You're welcome. Just gonna wash my hands. And you're not in any more pain?
No, I'm okay.
Okay. Good. All right. So I'm just gonna finish documenting the route, time, dose, where it was, that it was the IV line was flushed, it was patent. Okay. And we'll do the rest of it out here so you can get your sleep.
Okay.
She's gonna come out and I'll shut the door for her. Okay. Any more questions?
Yes. So, were there any important pieces of information you reviewed before administering the client the medication?
Yeah, well, we reviewed the 5 rights, so definitely checking that it's the right patient, right dose, right time, right volume, right rate. And then we checked that the client would be receiving her hemodialysis within the next 48 hours. If that were not to occur, we would need to know because the hemodialysis prevents the toxic buildup of the medication.
Okay.
The client should also be asked if she's had a reaction to penicillin or an allergy because of the cross-sensitivity, but her one allergy that she had was not consistent with that. And we want to make sure that the urine specimen was collected prior to administering the medication so we could test for the infection.
Okay, so did the information affect your decision to administer the medication?
Yes, if the client was not receiving her hemodialysis, we would not want to give the medication.
Okay. Did the information affect how you administered the medication?
No, the doctor's orders were for IV, so we checked the IV site and it was patent, so we were able to give her the IV medication. It can also be administered IM, but the doctor's orders were IV, so we stuck with that. And yeah, the site was patent, therefore we gave it to her IV.
Well, thank you so much, Shelby.
You're welcome.